Thank you very much,
We
Mr.
appreciate
Chairman.
it.
Thank you.
All right, our next and last for the day, the one that is keeping us from going outside and making snowballs and throwing them at each other, is Commissioner Frank Berry with the Department of Community Health. We'll give him just a minute to come up and get set up.
Are you leaving?
I'm just going down here, and we're gonna have Butch up here in the hot seat.
I didn't want you. I'd give you some sugar here, but Katie's giving it all away. There's nothing. Yeah, I'm so far away.
All right, Mr. Commissioner, thank you for being with us this afternoon, and we kind of look forward to what you got to say. It usually costs money every time, though, so we'll see. In all seriousness, thank you for what you and your team always do, and looking out for Georgians, and we appreciate the effort, the long hours, and the many days and sleepless nights that y'all have dealing with a lot of issues. So thank you for that, and the podium is yours.
Thank you, Mr. Chairman and Chairman Hill. It's of course an honor to be here with you again. I think this is year number 5. So I never forget just how important it is to be up here with you all and your support. So thank you very, very much. I also want to do something a little unofficial, which is call out my daughter who's here. My 13-year-old daughter wanted to find out how this actually works. So I said, well, why don't you come up and watch? And so Mia is here today. Mia, where are you? There she is in the way back. So I'm thrilled that you're here. So thank you.
Yeah, we're going to, everybody hold your questions for Mia. We'll be letting her answer those.
I've tried to teach her a little bit about what this is like, and she's heard some of your names for a number of years now, and I thought that she's old enough to get to at least see this in person. So thank you. And before I
hold on, Chairman Hills won't know exactly what kind of names have you been using. So
the most pleasant, names you could ever imagine, especially on those Friday, Saturday, and Sunday mornings and nights. Always with the highest regard. But before we get started, and I know we're late in the day, but I did want to recognize the DCH team. Lisa Marie is here. I know most of you know Lisa Marie, and Lisa Walker is our Deputy Commissioner, Chief Financial Officer. You'll hear from her. Blake Fullenwider has joined our team and has done a remarkable job. Mario Ellis, Marcia Hopkins, Joe Hood, Andrew Johnson is in the back as well. I know most of you know Andrew and Kate Furman. When I left DBHDD, I was not certain that I'd ever be able to find as great of a team. And I realized pretty quickly that the DCH team is really an incredible team of people. And I'm very fortunate. I don't sometimes wonder how I ended up in this role, and I know it's because there's a tremendous amount of talent that works with me at the department who really help guide that department. I also wanted to take just a moment to thank Lee Wright and Tara, Elton Davis, Martha Wigton, Melody, Chairman Hill, Chairman England. You all have for years been phenomenal support, so thank you very much. We work very closely with Representative and Chairman Butch Parrish. Your support does not go unnoticed. Senator Burke, the meetings throughout the year are extremely helpful when we get to discuss some of the challenges that we're faced with. And I also wanted to just take 2 seconds to recognize Katie Dempsey. In my previous role, your support and guidance helped me become a better commissioner, so thank you. And Renee Unterman as well. And really, a person that has just, for the last year, been there day in and day out is Teresa McCartney from the Governor's Office of Planning and Budget. When I was asked to come over to this department, Teresa and I kind of made an unofficial agreement that we would know each other's business, and she has not let up on trying to figure out creative ways to solve some of our problems. So that connection with Teresa has been incredible and a tremendous support. Before we get into the budget numbers, there's a couple of things, and I know there's many new committee members and new members to the General Assembly. DCH was created back in 1999. We serve as the lead agency for health care. We provide access to health care services for 1 in 4 Georgians, approximately 2.7 million people. And we have approximately 1,000 people that are on our team. The major programs, and most people think of DCH, they think of only Medicaid, but there's many other divisions that we operate. Of course, Medicaid, where we serve almost 2 million people. We also administer the state health benefit plan. Healthcare facility regulation, where we oversee 20,000 facilities. The Office of Health Planning, several of you are probably familiar with that Certification of Need initiative, and we administer that. And then the State Office of Rural Health. A couple of things about Medicaid. We're the federally authorized medical assistance program with the ability to draw down federal federal funds through our state matching dollars. We provide health coverage to low-income individuals, pregnant women, and people with disabilities and their children. We help support long-term care, pharmacy, hospitals, primary care, and other medically necessity services. State health benefits, self-insured. It's a self-funded plan that offers benefits to state employees, teachers, non-certified school employees, as well as to their families. Plan options offer medical, wellness, and pharmacy benefits. We have 664,950 covered lives that we provide under the State Health Benefit Plan. As I mentioned, HFRD, Health Facilities Regulation Division, we regulate 20,000 plus healthcare facilities. Responsible for licensure, surveys, and complaint investigation. We ensure compliance with state statutes, regulations, and federal certificate requirements. And of course, the Office of Health Planning, the Certification of Need program, and the Office of Rural Health, which received more attention this off session than we ever have in the past, and Chairman England and others played such a significant role in helping pull people together to address some of those issues. We support rural areas for regional health care issues. We support access issues for underserved areas within Georgia. I want to touch bases on a couple of the agency accomplishments for 2017, and this was in recognition of all of the work that you all did to help us eliminate the nursing home complaint backlog. When I first started, there were approximately 200 unanswered nursing home complaints. We came to you with a request for more dollars to be able to recruit and retain a higher level of nursing staff, and I'm pleased to say that we have eliminated that nursing home complaint backlog, and that was in great part because of the support we received from you. The backlog was work that had not been completed within the state or federally required timeframes. There was a couple of ways to do that. One, we certainly increased the pay, but the other thing that received a national award for was what we call the WOW program, the Work on Weekend program. And that's where we offered the opportunity for some of our nurses to work on weekends and go into some of those facilities to address some of the unanswered complaints. That proved to be so successful that it's a national model now, and we actually won the National Best Practice Award from the Association of Health Facility Survey Agencies. That was under Joe Hood and Melanie Simon's leadership that they were able to accomplish that. We also just 2 weeks ago were informed by CMS that their oversight with the technical assistance consulting firm that they had put in place has now been removed. So we have CMS out of our business in some regards, which is wonderful. The other one that I wanted just to touch briefly on was a reduction in the Community Care Services Program. You all may know that as the CCSP. When we started, there were approximately 2,010 individuals on the waiting list. We have reduced that by 830 for a total on the waiting list now of 1,180. This one I'm extremely proud of because it demonstrates, and something that you all ask us about on a regular basis, how are the agencies doing working together? And I think this one out of all of them shows what a remarkable job the agencies do when they put their heads together and work cooperatively. The Autism Benefit Package, January 1, became effective. I want to caution us to be very careful about how we talk about that, because even though the benefit now is available, the ramp up with recruiting and the retention of staff and getting people trained will take some time. But for the first time in Georgia's history, we will have a comprehensive autism benefit package that will be available. And all 4 departments that touch children with autism and their families now will have access to that. DBHDD, the partnership, and I know you just heard from Commissioner Fitzgerald what a remarkable job they have done in helping get that autism benefit up and running. Commissioner O'Neill with Public Health and DFAC certainly played a significant role in that. The other one that I think is really, really important, and this is really what we want to start focusing more on, we did an administrative simplification for the Katie Beckett waiver initiative. What we heard from families was that every year having to apply for that Katie Beckett waiver was just brutal for them. And so we listened to families, we listened to members of the General Assembly, we listened to the pain that was causing them by them having to constantly, they would submit their application and they would go out and have a great dinner that night and celebrate, and the next morning they would wake up wondering whether or not they were going to get approved for the next year. And so after working with stakeholders and working with CMS, Blake and Kate were able to figure out that we can make this a 2-year renewal process, alleviating some of those challenges that families were dealing with on a year in and year out basis, and making it a 2-year reauthorization process. And so we're very pleased with that. We also were able to successfully, again, working with Commissioner Fitzgerald and her team at DBHDD, we were able back in February, March, to successfully submit for the comprehensive waiver that had been held up from CMS. So I'm very pleased to announce that that has been implemented, and those providers were able to get the rate increases that you all had approved the previous year. And then finally in July 1 of this year, we implemented new CMO contracts with very little disruption to families and children, and we also added a 4th CMO to the mix, and again, the implementation of that went exceptionally well. So those were a couple of the major areas. We focused on 3 things as a department when we started right at a year ago. We focused on teamwork, we focused on communication, and we focused on customer service. I believe that the team of almost 1,000 people now believe that if we accomplish those 3 things and put effort on those 3 initiatives, that good things can happen to the people that are in desperate need of the care that we either provide or oversee through networks of providers. I think the last thing that I'll say before we turn it over to Lisa for the actual budget numbers is that Mariel Ellis, our general counsel, recently attended a joint meeting with several of the other departments, and there were presentations done about quality assurance and things like that, and you'll hear our budget request for that. And one of the things that she made mention of from the department that I used to work with was that they expect excellence out of each other, and I think you heard that from Commissioner Fitzgerald previously, right before I came up. We're expecting the same thing in our department. We expect excellence from our team members, and I've learned over the years that they want to be challenged. Your questions throughout the session, your questions throughout the time in between session helps us become a better department and helps us become better stewards of taxpayer dollars. And so, again, I want to thank you for all of your support throughout the years that I've been fortunate enough to lead two of our departments. It has been a remarkable experience and something that I deeply treasure. I'll ask Lisa Walker to come up and talk about our budget numbers, and then we certainly want to leave time for questions and answers. So, Lisa.
Good afternoon. I'll start by giving an overview of our current 2018 budget appropriation. In 2018, we were appropriated $14.8 billion. Of that $14.8 billion, $3.1 billion of that was in state funds. Of the $3.1 billion in state funds, 97% of that is spread in our benefits program, which is Medicaid, our Medicaid age blind and disabled population, and our low-income Medicaid population. And the remaining 3% of that is spread throughout our licensure, certification, and departmental administration programs. As we transition into the amended fiscal year 2018 recommendations, I start with the recommendation of benefits growth. There's a benefits growth of 1% over our fiscal year 2018 base, and that benefits growth is mainly in age blind and disabled program, as it relates to utilization increases, medical trends, and other cost drivers within the Medicaid program. The next item is nursing home provider fee. That's a reduction in nursing home provider fee based on the forecasted collection for fiscal year 18, and we project that that might be decreasing in fiscal year 18 also. Hospital provider fee revenue. There's an estimated revenue projection for $758,000, and the revenue projection is an increase for the hospital provider fee, and those items are also in our benefits programs. The next item is Indigent Care Trust Fund, which is our DISH, disproportionate share hospital payments. There's a recommendation of $23 million in that particular program, and this is for the private hospitals. And this is the state match that goes to match the federal drawdown for the uninsured individuals that's impacting those particular hospitals. The next item is statewide adjustments. These are statewide changes that the governor's office put in as it relates to changes in operational costs as it relates to personal liability, merit assessments, cyber insurance that affect all agencies across the state. And that recommendation is a decrease of $5,220. The next item is healthcare access and improvement. This is the program that houses the Office of State Rural Health. In that particular program, the recommendation is for the Swing Bed Education Grant, which is a $200,000 recommendation in terms of utilizing existing funds. And that particular grant goes to provide small, rural, and critical access hospitals expert training and guidance regarding the swing bed program. And it is to utilize existing funds for that initiative. The next item is Rural Hospital External Peer Review Network Grant. It's a $150,000 recommendation for that grant program also, and that's to utilize existing funds. And that particular grant program provides for the development of rural hospitals peer review program that will create ongoing systemic database process for rural hospital medical staff to evaluate their practitioner performance and provider network. The next item is also State Office of Rural Health, which is health care for the homeless program. State Office of Rural Health initiated a program that helped provide medical coverage for those who are homeless in the Atlanta and Savannah area. Most of this coverage is conducted at shelters within the state. The next several items is within our departmental administration program. Most are IT related based on federal requirements and ongoing initiatives. The first is electronic visit verification, which is a system implemented by the federal legislation in December of 2016 called the 21st Century Cures Act. It was signed into law in December of that year. And that is to go forth for health home visits to be documented as health home care workers go to visit their constituents. And that's a recommendation of $1,443,000. The next item is the new Medicaid Managed Information System, what we refer to as MMIS. That is also a requirement that came into place during the implementation of ACA a number of years ago, and that's to modernize the current MMIS system, and that is a re-procurement with the ability to interoperate between modules and multiple vendors in terms of sharing information. The next item is Medicaid Information Technology Project, which we call MITA projects. And that's a CMS effort also to advance the development, integration, and standardization and automation of our Medicare enterprise to make sure that it is operating and administered across all Medicaid programs. And that recommendation is in the amount of $1,742,000. The next item is our enterprise data solution, which is also an IT project. And this is a procurement to replace our old legacy system, which is called the Decision Support System. And this will help support advanced analytics, data warehousing, and modeling capabilities so we can have better healthcare data to, so better decisions can be made strategically in terms of managing healthcare. The next item is the third-party liability procurement. The procurement for our third-party liability vendor is beginning to end, and we have to go and procure that third-party liability vendor. And third-party liability is the legal responsibility of a third party to pay claims for cost avoidance against the Medicaid program. The next item is autism capacity building of $1,118,000, and this is a continued effort to help expand the provider network as it relates to autism and children's services within that initiative. The next item is Autism Program Coordinator. A recommendation is to utilize existing funds of $12,675, and this is for Autism Program Coordinator to help collaborate the activities and help roll out the implementation of autism as it continues to be implemented and as the utilization it will increase in terms of its current rollout. The next items are for fiscal year 2019. And some of these same items that I mentioned in 2018 will be the same in fiscal year 19. The first of those is benefits growth for the age, blind, and disabled and low-income Medicaid program. And the recommendation is for $45,694,000. And that's a 7% increase over our base that was appropriated in 2018. The next item is the replacement of tenant funds with state funds. This past year, tenant funds was used in our appropriated budget, and tenant funds was one-time funding, and this is a replacement of those funds to continue the operation in the Medicaid program, and that recommendation is $92,371,000. The next item is for the federal Medicaid assistance percentage adjustment. This year, the federal government reimbursement percentage decreased from 68.5% to 67.62%, which means our state share would increase in terms of how much we would have to put up for match to draw down the federal funds. And that recommendation is $57,881,427. The next item is the health insurance fee. This is an ACA mandate fee that health insurance providers have to pay as it relates to being a part of the ACA. Last year, there was a moratorium to be exempt from paying the fee, but it was reinstated in 2018. So the recommendation for that health insurance fee is $220,000. The next item is hospital provider fee adjustment. This adjustment is for a recommended increase in revenue collections of $15,294,000. The forecast is that hospital provider fee will be increasing for FY19. The next item is nursing home provider fee. We continue to see a decline in the collection of the nursing home provider fee, and that reduction in terms of nursing home provider fee will be $14,142,000 in terms of that collection. The next item is the direct graduate medical education expansion. And this is an expansion to increase the for an increase in medical residents at teaching hospitals, and the increase And the recommendation for that particular program is $1,700,360 for graduate medical expansion. The next 4 items is directly impact our elderly population as it relates to nursing homes. There's a 4.3% nursing home reimbursement rate increase for all nursing homes. And the recommendation for that is $16,894,000 for a 4.3% nursing home rate increase. The next item is liability insurance for nursing home. That's a change. That recommendation is for a change in methodology. In terms of the liability insurance will be removed from the administrative cost-based rate, and a different methodology will be used to pass that liability insurance to the nursing home, and that recommendation is for $5 million. Alternative living services, there's a recommendation of $3,378,000 for our alternative living services rate increase. The rate is increasing from $37 a day to $50 a day, and that recommendation total is $3,378,000. And the next item is for an increase of personal needs allowance, moving the personal needs allowance from $50 to $70, an increase of $20. And that recommendation is $800,000, and this is one installment of 2 installments that the governor recommended to be in place. The next item is for healthcare facility regulation, and this is the passage of I want to say it's SB 44 in terms of on-site inspection on narcotic treatment programs, and the recommendations for $244,000 for those inspections of the narcotic treatment programs in the state. The next item is for healthcare access and improvement, and this is the State Office of Rural Health. And for healthcare for the homeless program, similar to the recommendation in amended year 18 of $66,371. And the next item is a transfer of the health information technology program to the admin program. This is just a realignment of related functional activity. This is an IT-related activity being transferred to Department of Administration with the IT program. And that recommendation is $1,762,000 reduction, but you'll see that going into Department of Administration of $1,762,000 also. Moving into Department of Administration, autism capacity building. There's a recommendation of $847,000 for the continued capacity building for the rollout of the autism program. The next item is autism program coordinator to annualize that in 2017 with a utilization of $50,700 for that particular coordinator. The next item is long-term care provider background checks. Recommendations for $962,000 to utilize existing program that's currently in departmental administration. That's to do background checks for long-term care, nursing home, personal care homes. The quality assurance is the next item. This is the response to a corrective action that we received from CMS. This is our corrective action as it relates to the quality assurance with the oversight of the waivers. And this quality assurance section will be within the Medicaid, and that's to oversee our waivers to make sure that it's in compliance with CMS requirements. And the recommendation is for $1,121,000. The next item is electronic visit verification, and that's a continuation of the maintenance and operation of the implementation of that system for home health care providers. And the recommendation is for $894,000 for the electronic visit verification system. The enterprise data solution is also a continuation of the maintenance and operation of that EDS system once implemented for the procurement to replace our old legacy system, which is the decision support system within the Department of Community Health. The next item also is the MIDA project, which is the Medicaid Information Technology project. It has to utilize existing funds of $111,000 to continue the CMS effort to advance the development of integration, standardization, and automation of the Medicaid enterprise system, and that's to continue to allow Medicaid programs to work efficiently across the board. The next item is for right from the start caseworker retention, and that's to utilize existing funds of $67,000. We have a turnover of 8% regarding our eligibility workers regarding right from the start Medicaid, and this $67,000 will go forth to make salary adjustments to help retain those employees. This is the item I mentioned previously regarding the transfer of health information technology program to admin, and that's the functional realignment of related activities as it relate to our information technology program. The next item is statewide changes within the fiscal year 19 program, and those are the changes that the governor usually recommends to be placed in our budget for operational costs, as mentioned previously, regarding merit assessment, personal liability, and cyber insurance regarding all state agencies. That concludes all the recommendations related to Medicaid. The next recommendations will be that related to state health benefits program, and that's our program that funds the health care coverage for all state employees, teachers, and school service workers. The first of those recommendation is a projected growth of $158,747,000 as it relates to projected growth within the SHB program. And you'll see yes in all the amounts because those funds actually come from state agencies paying on behalf of their employees into the state health benefit plan. The next item is to increase autism benefits to age 21, and this is to expand age range for parity along with the Medicaid program to make sure that coverage is available to our state employees also. The next item is the 2018 Kaiser procurement savings. These are savings that was anticipated to be lower than what we originally projected in terms of the procurement of Kaiser, and this is a savings within the program of $2,478,000. The next item is for the Medicare Advantage procurement savings, in terms of those who are 65 and older who are retired, and these savings also relate to the procurement of the particular vendor for the Medicare Advantage program. And that savings is $32,541,000. The next item is the Medicare Advantage employee contribution change, and that change is an increase of revenue going into the state health benefit plan, and that is a premium increase for members who will be choosing the Medicare Advantage plan in retirement as their health care coverage. The next item is non-Medicare Advantage contribution change, and that recommendation is for $12,100,000, and that is for active state employees who are paying into the state health benefit plan, and that's a premium increase for those employees who are paying into that plan. The next is the procurement savings as it relates to pharmacy benefit manager procurement savings, and we procured a new vendor to offer that particular pharmacy benefit manager program, and the savings with the procurement of that is $3,182,000. Those are the recommendations for amended year 18. It's the same type of recommendations for 19 also. There's just a change in the dollar amount with a projected growth increase for fiscal year 19 of $263,591,000 for projected growth. The autism coverage is also in the fiscal year 19 of $2,200,000. The Kaiser procurement savings is projected to be $6,980,000 on an annualized basis projected for 19. The Medicare Advantage procurement savings is projected to be $61,555,000 related to the annualized projection for the Medicare Advantage procurement savings. The Medicare Advantage employee contribution change for fiscal year 19 is projected to be $5,499,000 for fiscal year. Non-Medicare Advantage contribution changes is projected to be $12,100,000 for fiscal year 19 also. And the pharmacy benefit manager procurement savings is projected to be $3,597,000 for the procurement of the new pharmacy benefit manager. And this concludes all the recommendations for the Department of Community Health in terms of its Medicaid program and state health benefits program. And I'm open for any questions if anyone has any questions.
All right. They're just popping up here just like popcorn popping on the stove. I mean, it's 15, 20, 33 questions. You ready? All right, the first one is going to be Senator Powell Sims.
Thank you, Mr. Chairman. My question is about the state health benefit plan. Just prior to the holidays, we had a teacher in our district, Representative Green and I, who petitioned to have surgery on her legs. This is a paying customer, okay? She's a retired educator, and was turned down numerous times and was told that this was an elective surgery, which it was not. She had blood clots in her legs. Who decides who gets surgery? Do we have someone out there that has no medical training? Her doctors wrote letters on her behalf, talked to people with the, but who decides who gets surgery? So unfair to those individuals that pay into the system and expect to get covered when needed.
So historically, the insurance companies that we contract with through state health benefits have mechanisms for in place so that doctors can have doctor-to-doctor consults. But once you contract out with the insurance companies and the third-party administrator who does some of those reviews, it's really, it gets out of the department's hands and becomes more of an insurance company to an enrollee discussion, similar to how any of us would go about having to argue with a doctor to try to get something or not. I'm familiar with that situation, as you and I had discussed. It's frustrating, and I understand your frustration. The department does not play an active role in that level of discussions. It really becomes doctor to doctor.
So how can we prevent this from happening? Because she's just one, I'm sure, of many.
You know,
Maybe this is a discussion we need to have later on, because we
and
can't get an
can
answer
certainly
right
do
now.
that. We can certainly do that, bring over our people from state health benefits and have some further discussion on it. It's very difficult for the, unless you make changes where the department plays more of a role in that oversight.
Exactly, exactly.
But the way our system is set up right now, that's not what happens. But we can certainly come over and have further discussion with you on that.
Thank you, Commissioner.
Commissioner, I'm getting a couple of questions from constituents who are nursing home residents about the increase in the personal needs allowance that was passed in legislation, I believe, last year. And I see that, am I interpreting this budget item here of $894,000 to be says first of a 2-year installment to fund that? Am I interpreting that correctly?
That is correct. Based on our conversation with OPB, we gave them a projection of how much it will cost, and it was 1.6. And the recommendation from the governor is that this is a first installment of 2 that the department will receive as it relates to the personal needs allowance increase. The other part of the personnel allowance increase is in DHS. They receive part, and we receive part of the personal needs allowance.
Say that again. I didn't understand what you said.
The personal needs allowance, this is the first of 2 installments. The total cost to increase it, the allowance from $50 to $70 is 1.6 in terms of how it impacts the Department of Community Health. And the recommendation is that this is the first of 2 installments, so this is half of the total cost.
So the nursing home resident will see half of the increase the first year then, $10?
Yes, sir, based on the recommendation.
I went back and read that legislation, and I don't see anything in there about taking your time to fund it. It says we'll, way I read it, looked like we needed to start it, to have started this past July, the way I interpreted it. But maybe I'm not a lawyer, thank goodness. But I was in the preparation of writing a letter to the commissioner asking for an answer, and I may still write the letter after I reread the legislation again, too.
Let us also, and if we've done, if we've either misread something or misunderstood something, then we'll correct that as well.
Apparently, these ladies and gentlemen in nursing homes can read pretty well, because they brought it up to me by phone and by email. You know, these be pretty sharp folks. But I you know, it's coming out of, I guess the thing that, I mean, I understand we're paying a substantial portion of their costs, but it's coming out of their Social Security check. So, in a pure sense, it's their money, and I just don't understand why we aren't going ahead and funding it as $50 a month. It will barely get their hair done. I mean, the basic things that they need. And I just thought, when I saw that legislation, I just thought that was a good thing to do, and yet here we are stretching it out. I just don't understand that.
Give us a day or two, and we'll look into it.
Okay.
First thing
Thank
tomorrow
you very
morning.
much.
Representative Hughley.
Thank you, Mr. Chairman. This question, Mr. Commissioner, comes from Representative Abel Mabel Thomas, and her question is about maternal health and specifically maternal morbidity. If you all have that under your purview, or is that Department of Public Health?
More Department of Public Health.
Thank you.
That was an easy one. Thank you.
Representative Dr. Hawkins.
Thank you.
Or Dr. Representative, I don't know which it is.
This is not a question. Usually I have a lot of questions. I just want to say to you publicly, I appreciate everything you've been doing. I feel like I've had great access to your department. You've always answered questions. You and Marie have been a breath of fresh air. Appreciate the Katie Beckett work. We worked on that 10 years ago and couldn't get it done, and you've done it within a year. I wish we had a Frank Berry in Washington, D.C. at CMS. Go a lot easier for us. Thank you.
Thank you very much, and your support over the years has been incredible, and I just have to recognize our team. They're a phenomenal team. I think that they come over here whenever they're asked, and I'm fortunate to work with just an incredible team of people. So, but your support has been just tremendous. Thank you. Thank you very much.
Representative Dickerson.
Thank you, Mr. Chairman, and I'm not quite sure if I heard the Chairman Hill ask the question about the $894,000 on the Medicaid, but I wanted to know, with this verification, is this a system that you all are using that each discipline would use when they go into the House for Home Health Care, and you are providing these machines to them?
That's actually a system that has to be developed. It has not been developed,
Okay.
and as a requirement by the federal government, the 21st Century Cures Act, and this funding will actually be to actually develop that system to have in place by January 1st, 2019.
Okay, thank you.
Mm-hmm.
Representative Petrie. I can't even
Thank
say
you, Chairman.
it
It's
this
Petrie.
afternoon. I know.
Commissioner, first of all, I want to echo what Representative Hawkins said. We really do appreciate your leadership and all of your staff who always so available to answer questions. My question for you is, have you all considered at all in light of our goal going forward to be fiscally responsible? And we last year in the House passed a tax cut that's sitting in the Senate. Have you looked at managed care for long-term care? Even if you carved out skilled nursing facilities, my understanding, data shows you'd save anywhere from $350 to $400 million by managing the ABD population. So are those conversations being had in any way, shape, or form at this time?
No, not at this time. We are developing better ways of managing the managed care contracts that we currently have. And I think that can help inform some discussions that will happen as we prepare for the healthcare environment of the future. But currently there are no discussions in the department to look at managed care in other areas right now.
Thank you, Commissioner.
Okay, one more question. Representative Darlene Taylor. Chair
Thank you,
Lady
Mr.
Taylor.
Chairman. I too would like to thank you for being able to work so well with the department. It means a lot to us when you're so open and readily available, so thank you. I have a quick question, and it has to do with the pharmacy benefit management, which you know was a concern of mine. And it shows on the 2018 adjusted budget that we will save $3,182,000. I guess that's what it's indicating, and that's for the 6 months of the adjusted budget. When I look at the 2019, it shows $3,597,000, and that would be the entire year. Why wouldn't it double if it's 12 months, or?
Although this is amended year fiscal year 2018, this is for a calendar year, so the $3,182,000 is for a full year.
So you're looking at it for 12 months?
Yes, ma'am.
Okay, thank you.
Mm-hmm.
And I, again, we've gotten to know each other over the years as well, and your support and our time together down in your area has been a great memories, and looking forward to doing more of that. Thank you.
Okay, that appears to be all the questions. Commissioner, again, thank you.
Thank you.
And your team for all that you do every day, and I would echo the same sentiments on the responsiveness that y'all have provided over the last year or so, and just thank you so much for all you do.
Thank you. Thank you. Very nice.
Ladies and gentlemen, we are adjourned until tomorrow morning at 9 o'clock. 9 o'clock tomorrow morning.